Hi everyone, I'm Sinan Pua from Center of Balance, the acupuncturist. Well, waiting for you guys to come in, and this is our live video. We're going to talk about headache. I'm going to show you some acupressure point for headaches. So now if you watch this video, if you're on this live video, please say hi to me and give me a thumbs up and share this live video. So I've seen someone's joining in. Please let me know who you are and say hi to me so I know who you actually are. Thank you. And for I'm going to put this video, this is gonna be record this video, this live is gonna record, and I'm gonna send it to anyone that is in at home that actually can't join us today. And tomorrow I'm going to send out an email later on and to show everyone and to announce that I'm going to give you a lower back pain acupressure point. Then I'm pretty sure that there's a lot of people who suffer from lower back pain, but they want to go for treatment. One of the bigger reasons at the moment is we can't go anyway because we're locked down level 4. But anyway, headache. 2 days ago, I showed you some acupressure point for neck pain. And I also show you how do you check out your range of movement, right? And today is the same. I'm going to show you how to check your headache, then some acupressure point for your headache. All right. Okay. Now first, today I'm going to show you some examination, for your headache. Second, I'm going to show you some acupressure point for your headache. All right. First, you're going to ask yourself, where about the pain? So some headaches will be on the front or on the side. Migraine normally go to the side, but some migraine will go the whole head as well. So in the forehead, on the side, top, on the back. All right. So for you, it may not be any different because headaches are headaches. But for us, acupuncturists, there's big difference. Very different. Okay. Here's the difference. You see, over here, there's different meridian. On the side, different meridian, which is gallbladder meridian, kidney meridian. We call Sanjiao meridian over here. Bladder meridian over here, and Du meridian over here. On the front, right, we have Du meridian here, and we have bladder meridian here, and stomach meridian over here. You see? So that is big difference in Chinese medicine in acupuncture, because different part of headaches linked to different organs, linked to different meridian. So the diagnosis for us is very important. Once we know where it linked to, then when it comes to treatment and the treatment principle, that we'll be able to choose the right point to target the pain. I hope that makes sense to you. This is chopstick, This is chopstick treatment. Then if I have time, I'll show you how to use chopstick to get some treatment for yourself. All right. Next, we're going to do some movement of your neck. As I mentioned in the last live video, the neck pain will cause headache, which means the headaches, some of your headaches, it's come from your neck pain. So now you need to check out your neck by doing this or doing this. Now, when you do this or this, you may feel it get worse, then it's definitely from your neck. Even though you don't feel the headaches getting worse when you turn your head, right? So, and that may still come from your neck. So what we're gonna do is, when you turn your head to side, from side to side, I know you're feeling headache. Your headache is the main thing. When you turn your head from side to side, you feel the stiffness, the tightness. The stiffness and the tightness is there. That means you need to get rid of the stiffness and tightness of your neck. That's the first thing, right? Because by just pressing the point and get rid of your headaches, it may not give you complete relief of the pain. Not until you deal with your neck. Okay, that's why we need to check your neck first. Then forwards and backwards again. Like forward and backwards, if you feel any tightness or any pain in your neck, then yes, you need to get rid of the tightness and neck pain as well. And there's another one. Bring your ear to the side. Bring your ear to the side, the other side. Right? And again, you feel it whether there's any tightness or pain. If you do have it, please note it. And then we're gonna come back to the neck later on. Then I'm gonna show you a way that doesn't matter whether the pain is on the side, on the front, top, or in the back. Then once you press all this point, you're gonna get rid of all. You're gonna target all the pain because what happened in here is, I want to show you a way that is simple that you can apply it. You don't have to have the meridian knowledge. Which point go to which meridian to be able to relieve the pain. Does it make sense? So, because this video is for everyone, not an acupuncturist. If you're an acupuncturist, I'm going to tell you, hey, this point is going to this point, this pain over here, right? And it's not going to work for this point, pain over here. You see what I mean? So yeah, I'm showing this this live video is for everyone, for all my patients. Right? It's not for the acupuncturist. So I'm going to show you a way that you go to it, and it's for the whole head. Doesn't matter where the pain is, and when you hit the point, you're going to get relief anyway. Okay, now pain. When pain appear, according to Chinese medicine, according to acupuncture, that's because blockage. Right? They're saying that in Chinese, so 不通则痛, which means if there's a blockage, there is pain. And 通则不痛, when there is no blockage, then there is no pain. So what does it mean? It means that when there is blockage in the meridian, and what we believe is the meridian is a pathway of blood and energy, or we call it qi. So when the blood and qi, the energy flowing through the pathway, smoothly, non-stop, keep going, there is no pain. For some reason, doesn't matter what reason it is, it clogged up there. The blood flow can't go. It stopped over there, and that started to create pain. You think about it, this is when the blood flow keep coming, and it can't go through this spot. It can't go to this spot. It clogged up over there. Then the pressure become bigger and bigger and bigger and bigger. And that is where you start to feel pain. So what we're doing is, we remove the blockage. By removing the blockage, the blood flow go through it, and that is when you start to get pain relief. Does it make sense? So you need to have this kind of thinking, the theory. This is the theory of Chinese medicine and acupuncture when it comes to pain. Now, there's two ways we can do it, right? When there's blockage, we can go and remove the blockage and get the blood flow through the meridian. There's another thing is we can increase the force of the blood flow and energy. So we pump it over here and get bigger force, bigger pump, more force from the organs, and then the blood flow and energy become bigger, and it actually go through the blockage. Boom, and it go through it, and that is when you start to feel pain relief. Does it make sense? Okay, I hope you get it, and that is the theory in Chinese medicines. Now next, we have two strategy. It always come with two strategy. One is local point treatment, local point strategy. Next one is distal point strategy. The local point strategy is if you have pain on your head, go ahead and massage your head and find the point and release the pain. The outcome will be two. One is working very well. You hit the point, you keep massage it, and you get fantastic result. That's good. Everyone can do that. You just go around where the pain is, hit the right point, and go for it. If the pain in the front, just press the front. If the pain on the side, you press on the side. Get the most sensitive one and gently release it. Massage it, right? Or you can just tap. And this is very simple. You can just tap the whole head wherever the pain is to get more blood flow in there to unblock the blockage. And everyone can do this. And this is the simplest way to do that. Now, I really want to show you one thing today is the distal point strategy. Because not everyone know how to do that. And it requires you have the knowledge of meridian, how they connect together, how the organs work to be able to choose those points. Right. Now, for the local strategy, it may work for you. If it works, keep going. That's fantastic. But if it doesn't work for you, that means because some people when they do a rapid, the pain actually get worse. You know, you actually the strategy that you're using here, tapping here, it increases more blood flow, but it can't unblock the blockage. Then more and more blood flow come, but the blockage still there. It become more and more pressure over there, and that is why you start to get more and more headache, and the intensity of the headaches become worse. Okay. Oh, when we talk about the examination, you need to ask yourself. You really need to ask yourself about how bad is the pain. Out of 10, from 0 to 10, 10 is the worst. 0 is nothing. There's no pain in 0. You rate your pain level first. Okay, it's 1, 2, 3, 4, or 5, or 6, whatever. Okay, and then you ask yourself whether the pain is sharp pain, just achy, dull ache, whatever, or there's any tingling or numbness. You see what I mean? Okay, now you write it down and then you start to do the practice the acupressure point. Okay, and then after that, you're going to ask yourself, the range of movement is improved or not? Is the pain decreasing or not? And what 10? And what about is it 5 or 4? This is how you measure the progress. Okay. Now, next, let's talk about distal point strategy. In distal point strategy, we're gonna work on your hand. if you have any pain in your neck or discomfort and stiffness, you go to here, right? Right, those points over here. Now, those points over here are very good for your neck. Very good, fantastic for your neck. And what you're gonna do is go to the video last time, that 2 days ago. If you're on YouTube, I just learn acupoint for neck pain live webinar. There's the topic on YouTube. If you are on my Facebook page, please go ahead, scroll down and find 2 days ago. Of course, there's a lot of other posts. 2 days ago, we have a live video over there. Please go and watch it, and those points are for your neck. Today, we're going to focus on headache. You must do the neck one for your headache as well. All right. Now, today, pretty similar. This is in here for your neck, right? You're going to move down a little bit, which is halfway over here. Halfway over here. Those are for your headaches. Over this point, we call 合谷 point. Large intestine 4. Okay. If you put your thumb and your index fingers together, you see that this is the higher point over here. This one is very good for headache. All right. And press it using your thumb or your knuckle, but I prefer you use thumb in here. So press it down. Press it down. Okay, as you can see that my hand is this way. So this is my right hand, this is my left hand. But let me turn the video over so you can actually see my right and left, what I'm talking about. Yep, here you go. This is my right hand, this is my left hand. All right. So my right hand forefinger go above my left hand and hold the fingers over here. And my thumb go to the point over here. So that's on the second metatarsal bone and between the first and the second metatarsal bone. And press it in the middle. Okay, I want to do this. So you press it, look at here. Okay, press it here. And you go to the bone. The second one, all right, to the bone. And what happens is if you press over here, you feel tension over here. But as you go toward that way, to the bone, you can find it, you can push your thumb in and you go different direction. Push it that way, bottom, sideways, and another sideways, all right? You will find that when you push in, if your direction is toward to the bone, that is where you get the most sensitive one. The pain is more sensitive, right? So someone knock the door. I'm on live video. Okay. Thank you. Right. So press it down and toward that way to the bone, and keep pressing it like this. Oh, it's so painful. So just press it hard, but not too hard. When I say hard, is you can feel the pain, but you can handle the pain. All right? Press it like this as you go. Keep doing this for about 30 seconds, or you can up to 1 minute. It's up to you. Now, any of you have headaches? Please let me know and type it down. You have headaches. If you have headaches, you should feel better. Right now, right away, you should feel better. Some relief. Some relief. Especially headaches on here. Especially headaches over here and on the top over here. Right. Press it down. Next. Remember we go neck one last time was in here. So the same thing. So from here to here, the second and the third metatarsal bone in the middle. Go ahead and find a point. Go up and down. Find the most sensitive one and press it like this. Right, and then go third and fourth and press it on it. Right. You may not feel any point of it. If there is no painful, no sensitive point on it, don't worry. Just go to the next one. Go to the next one. Go to the next one. Okay. And the last one is over here. So this is the fourth and the fifth. Between that and over here. And this one, I suggest you use your knuckle. All right. How to use the knuckle? Index fingers. Bend it completely. Use your thumb to lock it. That's one way to do it. And the other one is use your thumb and make a fist and use your thumb and the tip of your thumb and press it on the joint over here. Okay, so that's how you do it. It's better that way or this way. Okay, hit the right point. Hit the point. All right. When you get the point, you can go up and down a little bit and find the most sensitive one. And this one is actually good for back of your headache. Now, I've just shown you point from here to here. From here to here. Alright. 1, 2, 3, 4, 5. All these 5 points cover the whole head. Any pain in the front, top, back, or the side. Alright. Doesn't really matter where the pain is, and you don't need to know, okay, this one is for the front there, front headaches, forehead, and this one is for the back. No. You just go and reach all the point over here. If there is any sensitive point, please rub it for 30 seconds. And then you will get relief instantly. Now, when it comes to the middle, the point between here, and here, right? There is a between two bone. So when you do the acupressure point, you want to do it that way and go to sideways or sideways, close to one bone and close to the other, and to figure out whether there's any sensitive point in there or not. Now, middle point, sometimes the sensitive point will be in the middle, sometimes it's off the middle and go to the sideways. So you go to the sideways and rub it, and go to the sideways and rub it. Alright? So the reason I want you to learn this technique is important, because if you don't get it right, most of my patients, I'll show them, they say, oh, okay, I can't get it. You know, I just rub it and then I turn a little bit of direction under my fingers, under my thumb, or under my joint. And then I got it straight away. And I said, whoa, this is so painful. And then that's where they get relief straight away. You must hit the point. If you don't hit the right point, it won't work. Trust me. Alright? So do you get it? If you do get it, please comment down there. And please, learn acupoint for headaches. It's very important for a lot of people. And while the lockdown, I'm going to show you more and more and more. So this is day 4 of lockdown. Tomorrow is day 5. I'm going to show you acupressure point for lower back pain. Please follow me and please share this video to your family members who suffer from headache, to your friends who suffer from headaches, or anyone. They may not have headaches right now, but they may get it. You know, that's too common. It's very common people get headaches, right? And please share it to them. If you're on YouTube, please take the link, share the button. There's a share button, and you take the link and post it to your social media, to everyone, and or email them. If you're on Facebook, please, you can tag the name underneath. Under this, in the comment, tag your friend's name so they know this video. Or share this video on your social media. right? So I'm here to help as many people as I could, because I like to help people. I like to see people get better from acupressure point. And the way that I can reach more people, the way that I can help more and more people is by you to share this live video to everyone. Thank you very much, and please comment down there and let me know where you're from. I'll see you next time. Bye bye.